All right, it's a little touchy. Okay. So I was asked to talk about, how about some video too? I was asked to talk about how the DHS GIS team and DHS in general responded to the pandemic, and what it really meant for us as far as our data offerings and projects and maps and things like that. So by all means, if anybody has any questions, I'd love to see them pop up, and I'd love to be able to address those. And looking forward to interacting with you and answering your questions and hopefully sharing some useful information. Just a little bit about the team. The GIS team is a central team within the agency. We provide GIS core services to the entire agency, including spatial data services and hosting, provide enterprise address services through an enterprise geocoding service we stood up. We operate open spatial data portal, which I'll be talking about today a fair bit. Do lots of mapping and analyses. We do desktop support for GIS software, consulting. We do application development and hosting. We create and maintain data, and so forth and so on. Our team members, there's 3.5 positions. We're embedded, by the way, in the Information Technology Bureau, and we've got Ben Anderson, who's been with us about 10 years, Joe Tavano, who's been with us roughly 3 years, Julia Olson, who's been with us since September. She's our GIS technician, and yours truly, the GIS team lead. I've been here since 2014, and prior to that, I was the municipal GIS coordinator for 11 years at the city of Sun Prairie, Wisconsin. Well, digging right in, when the whole thing started, we were called into meetings with DHS leadership, and I had already been starting to ask, hey, can we get involved in mapping COVID cases? And ironically, Wisconsin Emergency Management and Department of Military Affairs had already called us and been asking, are you going to be publishing this stuff? And we said, well, we're hoping to get approvals to do that. We did get called into a meeting, and they said, our goal is to have a single publish every day for all public-facing data within the agency related to COVID. And we said, that sounds really good. We would prefer to not have, as well, we would prefer to not have multiple versions of the COVID data out there at any one time. And so they said, well, you know, we could do this through Tableau or something like that, and publish some charts and graphs and some maps within Tableau, or we could do it, or could you guys do it within the GIS? And we said, well, you know, what are you thinking besides the map showing case counts by county and case counts by state? And they said, well, you know, we'd like to have these charts and graphs for deaths and rolling averages or whatever. And we said, yeah, we can do that too. So what we basically signed ourselves up for was to hand code JavaScript apps to present stuff by charts and graphs by pulling our raw spatial data from our REST endpoints. And a couple guys on my team get purple hearts for that, because it was pretty relentless, because every single day there would be a new ask. It'd be like, well, can you enhance the chart to do this? Or can we add that chart? And we were kind of like, well, you know, we're building these from scratch. And sometimes they'd come down from the governor or the secretary's office, and they'd say, well, we need to have this one by the day after tomorrow. We're like, well, wait a minute. We're going to have at least some semblance of project management. Can you like give us the concept? Can we talk about it? Can we talk about business requirements and timeline and resources and the old process here? And they're like, no, you just got to do it. So we did. Luckily, the Tableau technology, which is fairly new in the agency, did come up to speed. And eventually we were able to transition some of these charts and graphs over to Tableau. But having said that, and by the way, we added additional RAM resources, new cores to the servers, and got all hands on deck monitoring our ArcGIS enterprise environment. We also worked hard early on to get a single source of data for case counts, knowing that when we had Tableau visualizations, we had GIS visualizations, anything that was still in JavaScript or anything else that we wanted, if we were all pulling from the same data extract, then we actually had a chance of having a unified public-facing single source of truth to the world for our COVID data. So we got that done. The other thing that I said on day one was, ironically, we'd had an open spatial data portal actually ready to go for several months. It's populated with data. We had nursing homes and hospital locations and some things like that in the data portal. And I said to my boss's boss's boss, I said, Clint, I said, the single best and most effective way to distribute the pandemic data to the world is through this open spatial data portal. And he said, what do you need? And I said, I need this to be approved to officially go live so we can put the COVID data in there and publicize the open data portal. An hour later, he returned with permission at my cube and said, yes, you can go ahead and populate with COVID data and publish the data through the portal. And I said, great. I said, when you go back to your desk, could you send me an email so I have that in writing, please? So from that day forth, we've had COVID data, and then we had about 40 other data sets in the open data portal. I assume many of you have visited that portal. So that's kind of how it all started early on. Lots of other areas of work, monitoring the GIS public-facing inbox, participating in data request triage meetings. You know, the agency gets inundated with requests, and there's a lot of epidemiologists and leadership and communications people every day. We're meeting to say, well, what are we going to put out? What can we put out? What can we do well? What can we do with confidence? What's the highest priority? So working in those meetings, inevitably I came back with more work, but it was the right, it was the thing we did. Of course, monitoring the server and our performance metrics, working to ensure that our data extracts met broad needs to feed the apps, maps, and dashboards. So trying to stay ahead of anticipated needs for data, developing new data sets, all the other fun stuff with metadata, data descriptions, approvals to publish, things like that. Did a lot of work, as I mentioned, with collaboration with our communications folks in the agency, public health educators, project managers, et cetera. Responding to data requests from other agencies, from various partners, news agencies around the world, electric cooperatives. It's amazing the breadth of people that contacted us and said, hey, can we get data about this? Are you gonna? And the fun part was, as we really got rolling with our lists of data we were gonna come forthcoming, we could say to people, well, we don't have those data today, but sometime late next week, we expect to begin publishing those. So would you be willing to watch our open spatial data portal or watch our dashboards on our website to see if we have those data available to you? And for the most part, people were really gracious and understood the load we were under and seemed to really appreciate the incremental progress we made over a period of months with the data offerings. And I hope that's true for people that are listening to this presentation today. And then the other thing that we did was the flip side, which is I spent a lot of time working on requesting and wrangling data from other agencies, working with partners, collaborations, things like that. Let's see here. So about our open spatial data portal, again, it's open data. The data are discoverable on the internet. You can view the data. There's good metadata. You can consume the data through APIs, and you can download the data in various formats. The fun part is that we sometimes got up to 2 million hits a day on the data portal. It's been pretty exciting to have to make sure that we've got enough horsepower behind it, but also to know that the data are in demand. The URL data.dhsgis.wisconsin.gov for those who may not be familiar with it. Progression of data offerings. We started out really with case counts, death counts, hospitalizations, and things by the state, and by the county. And we had live data, and then we had historical data. Then Milwaukee County, no, was it Milwaukee County or City of Milwaukee? I think it was the City of Milwaukee, had census tracts out very early. And I knew that that we wanted to expand our geographic offerings, and census tracts would be a good candidate. And then I actually got some calls from some of you. Some of you may be listening to this presentation right now. People in the counties, LIO offices, and things saying, "Hey, we really like your county data. We're able to consume it into our dashboard, but we're a county, and we really work at a more granular level. Are you going to be publishing any more granular data in the future?" So I floated the idea initially, and it was ixnayed by virtue of concerns about PII, PHI, the sensitivity of the data, because the case counts in some of the counties were so low that you might get like one case in a census tract. So we had to work through data suppression rules. And it's interesting, by the way, that by suppressing data, once you suppress the data, you have to continue to suppress the data for those tracts. And what it means is that even to this day, if you tally up all the cases for census tracts in one county and you look at the county values, they don't match up. And that's just because of data suppression. So, behind the scenes, we're working on all of this kind of stuff. We got that out the door, and it seemed to be very well received. So then we started in on another area that was much later coming. But we did develop zip code tabulation area, otherwise known as ZICTAs, which, by the way, for those who may not be familiar, that's a census, U.S. Census aligned representation or close representation of a zip code, because zip codes are actually not polygons and not areas. Zip codes are aggregation of mail routes, and mail routes are fluid. But zip code tabulation areas are something that you can report population or public health data by, and that's why we use zip codes. We also did municipalities, otherwise known as minor civil divisions, and school district boundaries. School district boundaries, this is kind of the behind the scenes look at school district boundaries. Those were really, really tricky. We had some meetings with public health officers across the state, and some of them did not want them out there, and some of them really did want them out there. Some folks didn't want more granular data because they were trying to do messaging by the county. Hey, everybody in the county, wear a mask. Everybody in the county, social distance. And they felt that if we exposed that some districts had higher counts, some had lower counts, or some municipalities had higher counts and some had lower counts, that it might be an inducement for potentiality for complacency in certain corners of the county. And again, they wanted to have uniform public health messaging across the county. So it's interesting the kind of feedback you get when you start wanting to be more granular with your data. The other thing that we ran into is confusion or concerns about confusion between school district boundaries and schools themselves. So, are you publishing the case counts for the school population? No, we were publishing the case counts for population best fit by census block units into the school district boundaries, and then pulling from that same data source, that Wisconsin Electronic Disease Surveillance System, all of those census blocks that are crosswalked into that school district boundary, and pulling the case counts into that, and then publishing those numbers and publishing those polygons with those numbers attached as attributes. So that's really what we were doing. And it's understandable that there was confusion about it, but we had to slow down our push of these data, because we needed to really work hard with our communications people and our public health educators on the messaging on this, to be very deliberate about the metadata and the data descriptions and the titles for the data as we went forward. At the same time, we were working on tribal boundaries, and it was decided basically by the tribes that they preferred not to have the tribal data published separately from all other data. And that was because I think there were some concerns about case count data in the tribal regions because of casino traffic, but also I think that they felt like they didn't really need the data to be public facing in order to do what they needed to do with it. So we actually did publish tribal boundaries in Tier 4, and that's in a portal that only certain individuals or certain organizations are able to see. They're able to see the data. Just like you can see zip codes or census tracts, they can see tribal boundaries. Again, same best fit. Testing site locations, you've seen the test sites map, and a wastewater genetic content sampling dashboard that I'll talk about in a minute. We're another tier that came forward. And right now we're working on vaccination site locations. And I'll have a slide about that in a few minutes. The wastewater COVID case counts. Interesting project. The fun part about the job is when the state public health officer calls and says, hey, we'd like to meet with you and your team members about a project for a grant we're getting from the CDC. How about Tuesday at 2 o'clock? So we go and they're like, yep, we're going to sample wastewater and treatment plants for COVID genetic content. And we'd like you guys to do two things. We'd like you to wrangle the wastewater treatment plant boundaries across the state for the 70 to 100 largest municipalities or service area populations of over 2,000. And we'd like you to do best fit for a population into those treatment plant service areas, just like you've done for best fit into school districts or best fit into municipal boundaries. And we said, sure, yeah, we can do that. Having 11 years as a municipal GIS coordinator under my belt before I came to DHS, I kind of knew where we were going with wastewater, and I knew there were going to be some challenges, but I can tell you there were a lot of Russian dolls in there, inside of other Russian dolls. Basically, we started asking, we put some specifications together. We worked, by the way, with the municipal user group within WLA, which was very helpful. The leadership and members of that MUG were very useful, or very helpful, very good to partner with in terms of distributing our ask to the membership and things like that. We set up a portal by which people could upload data, and we wrote a specification. Specification said, hey, if you've got polygons specific to your treatment plant, we'd love to have that. We'd also like to get your pipe network, your laterals, your mains. We'd like to get knowledge to know if your service area is commensurate with your municipal boundary, or if it's different or not. And then we started getting the ask out there, and then we started getting helpful calls from our friend, for example, Jenny Reek in Brookfield, and says, well, we've got 3 plants that serve the city of Brookfield, and Menominee Falls wastewater actually flows through the city of Brookfield to get to the Fox River plant. And let's just say it got to be far more complicated than I could have even imagined, being that I was a municipal GIS coordinator in a one municipality, one plant region. So that was pretty fun. But Julia, our GIS technician, has gotten, I think, a wonderful opportunity to interface with public works directors and wastewater treatment plant staff and municipal GIS folks, and even more so, engineering consulting firms of various types that serve the municipalities with their infrastructure mapping and infrastructure needs. Though she's gotten interface with those and pulling in data, quality controlling it, snapping it to minor civil division polygon vertices and lines and parcels and going back and forth. And she's built out now about 60 of those. A few of them were shovel ready, but most of them were not. Boy, oh boy. And then what really got interesting is when our friend, I think it was Emily Champagne, called from Sewer Pack and said, hey, you're mapping the sewer sheds for these 2 plants, the 2 that serve Milwaukee, but no, that's not static. She said, they change. If it's raining, we divert more sanitary sewer water to one plant than the other. If it's dry, the other plant gets more. And we're kind of like, oh, brother. I'm like, seriously, like, wow, this is getting complicated. But the good news is we've turned through it. We've got 60 of them up. Julia's still every day working with more communities and pulling their data and processing it and quality controlling it and getting ready to publish it and add it to our master shapefile. And we do have a wastewater dashboard up. And if you Google Wisconsin COVID wastewater, you'll get to see it, and you can look at your community. And said about 60 of them up. It does include those values from sampling at the plants, By the way, they're taking composite samples and mixing, and this is partnered with the State Lab of Hygiene, so doing a good job with a protocol for the sampling. And it does include the 7-day average for case counts curve relative to the best fit for the population. Again, we took our census block units and we best fit that. Some of the curves track very nicely. If you can see here, the sampling curve for Green Bay, and if you look at the 7-day average between September and February, you can see that the curves actually kind of track. So this is case rate for COVID, and this is the amount of genetic markers for COVID found in wastewater. So pretty neat. Now, in some cases, they don't track really well at all. And that's, I think, what the researchers are. We've got UW-Milwaukee, by the way, is involved. Professors UW-Milwaukee, State Lab of Hygiene, and like I said, DHS, epidemiologists, and our public health officer. They're getting into why not? Why are some of these work? Is it sampling protocol? Is it variations in population being variable? Schools in session, schools not in session. What's going on? Is it seasonal travel? What is going on to make some of these not track? So stay tuned for that. There should be more forthcoming from DHS and probably some papers published and some work through CDC on that. So. Vaccination sites mapping, that's what I mentioned is ongoing. Just a few notes on that. We got this project landed in our lap a little over a week ago. We're hoping to have something out the door. I'm not going to be too certain about it, but it looks like a week or two we'll have a vaccinations map. The one I have here in the slide is Minnesota's. There's a lot to that data. There's the vaccination sites that are workplace only. There's vaccination sites that are open to the public. There's vaccination sites that are only open to people in certain tiers, tier 1B or phase 1B, healthcare workers and things like that. So there's a lot of data behind these sites. The data are derived from a weekly allocation survey where the different public health entities request an allocation of doses from DHS. Those are evaluated for rates across the state, some issues with equity in terms of populations being served by the requested allocation, things like that. And then those will go out. And they also have to put where their vaccination sites are in the survey. And that's what the GIS team is working to wrangle those data, get them into a schema that's workable for our map, and ultimately get them into REST endpoints, and then build the map cartographically, get the iframes ready to put in the website, and then consume the data into the map so that when it's updated weekly, our map will update weekly. So that's kind of where we're heading with it. It'll have some pretty basic attributes on the sites themselves: site name, address, URL. The address, we're working on implementing a suggest feature. So like when you go to Amazon, you start typing your address and it gives you a choice of only valid addresses. We're working on getting that implemented probably into a later version of our survey so that we're dealing with only clean, valid addresses when we go to do our geocoding on the mapping. So we've got some quality control things we're working on as well. Let's see here. You'll see some other applications out there. There's one called Vaccine Finder that CDC has, and DHS is also simultaneously working on a vaccination registration site that will be forthcoming. That will have some location information in it, and we're trying to get the same single source of truth to pipe our vaccine site map, as well as this vaccine registration site, and perhaps it will be served back to CDC to be included in their site. I'm not sure how that side of it's going. So lots going on there with the vaccine data. Moving right along here, some pandemic takeaways. You know what, I think I skipped a slide. I might have it at the end of my presentation here. Let me take a look. Huh. I lost a slide, folks. That's okay. I'll give it to you verbally, and I'll add it before it's published. How are we doing on time here, moderators? Doing okay? Yeah. So forgive me for this. Let me talk about surge support. We had a bit of a concern early on about whether we were going to keep up with our regular duties, publishing data, publishing nursing home locations, things like that, serving everything from obesity prevention program to our smoking cessation groups to our nutrition programs, everything that the GIS team does, cancer registry and things like that. How are we going to do all that work and do all this COVID data work, especially when we're publishing data 7 days a week? We came up with the idea of doing some surge support. So we were able to get permission to bring in some surge staff. We worked with the Wisconsin Land Information Association to identify nominees or volunteers from other agencies who could spare some hours a week of their staff to be onboarded into the GIS team to help us do a lot of data maintenance and other duties as needed. And we got 14 nominees, which I was really thrilled about. And talked with some of them, reviewed their skill sets, their fit, and we think we actually brought narrowed it down to a list of 6, and we actually onboarded 3, and we had 3 on deck in case it became a protracted engagement and we needed to swap people out, like a hockey line. Let's bring in the next line. But we were able to bring in 3 people. We brought in Kevin Burns from the Board of Commissioners of Public Lands, Felipe Avila from the State Historical Society, and Michael Dis Torrance from Department of Natural Resources. And we're forever grateful to them for forever grateful to them for coming in and helping us out in a time of need. Ironically, Felipe Avila is actually back for a second tour, and he's actually been assigned to vaccine distribution and things like that. He's working very closely with the Wisconsin Emergency Management and DHS on that. So he's doing some analysis on vaccine equity, vaccine distribution, and things like that. So, as well as some other things. So that's been very nice. Very nice to have Felipe on board again, especially since I've worked with Felipe for upwards of 20 years because he was the municipal GIS coordinator at the city of Fitchburg. I worked with him through SAGIC, State Agencies Geographic Information Council, and now working with him again, doing GIS related to the pandemic. So this has been a very positive thing. Having the surge support allowed us to do a little cross-pollinating. We got some input into our own standing processes about, hey, have you thought about enhancing it this way? Could you do it that way? What's more, we had more time, we had more brains, we had more bodies to actually work through some of those enhancements. So our processes have been streamlined, made more efficient. And so I'm really, quite honestly, it's almost like exchange students or something, right? I'm really have become a fan of sharing staff on a temporary basis across agencies because of what you can learn, what you can benefit from. And by the way, we've had staff coming for the pandemic from many other agencies, from Department of Public Instruction, Department of Children and Families, and non-GIS staff that we've benefited from during these all hands on deck pandemic projects and meetings at DHS. So if you ever have a chance to volunteer, to be a part-time reassigned at another entity, another agency, another organization, I would encourage you all to give that serious consideration. Moving right along to some pandemic takeaways. One of the things that's for sure is that we have now within the agency a greater awareness of the power of GIS, and that's been brought up earlier in the session. Good number of people don't know what it is. They don't know that it's more than just cartography or map making. They don't understand necessarily because they haven't been exposed to it, the capabilities in terms of analysis. They might not understand the interplay between spatial data and non-spatial data. In our case, we're a very busy team. We're serving lots of entities across the agency, but there are a lot of entities within the agency who didn't really know that the GIS team was there and what our capabilities were and what our service offerings are. That's been very nice to meet new program area representatives, new people across the agency, and be able to do work for them, with them, partner with them on pandemic-related data. And we believe that in the future, it's going to give us more opportunities for more collaboration on more different topics across the agency. Again, many people have also been reassigned within the agency, so they're from the whatever program, and now they're working on vaccine distribution. They're getting to know us this way, and when they go back to their programs, they're going to have more maybe ideas about how GIS can benefit their program areas because they've worked with the GIS team on these pandemic GIS related projects. So this has been very, very positive, I would say. Also, there's the role for spatial data in the address services, address validation and geocoding. And as I mentioned, data interoperability within the enterprise. We have a lot of data silos at DHS, as you can imagine. That's historical because of two things. A lot of our funding comes in, it's grant funded, and grant funding can't be mixed very easily with other program areas. And also because data are more secure if they're locked in their own silo and basically not shared outside of the immediate use for them. And that's, you know, that's a mentality that doesn't necessarily fit with concepts of big data and data science and some of the places where we want to and need to go. And I can assure you that the pandemic has really opened up a lot of those thought processes, opportunities, collaborations, and awareness of how we can mix data, not only within the agency, but across agencies within state government. And of course, sharing the data out openly with you all folks and anybody else in the world who wants to consume the open data from an open data portal. Again, we established our open spatial data portal as the go-to source for COVID and non-COVID DHS spatial data sets. It is here to stay within our agency. We're very happy. I proposed this portal as early as 2014 when I arrived. I've been working on it for a couple of years. I had a dedicated staff who had built it, and that's why it was shovel ready before the pandemic came. And of course, we said we need the portal because if we have a flood in Northwest Wisconsin again, like we did a couple years back, and they need to make sure that they understand where the roadblocks are, for example, and where the dialysis centers are, and so they know if there's access to the dialysis center, so dialysis patients can get their treatments. You know, we knew that we needed a portal to get data out there for things like that. You know, we knew that we had sort of short-term needs for these data. We never imagined that you know, our nursing home locations would get used over and over and over again over a period of a year, basically, for the same ongoing pandemic. But we're glad that we'd already mapped our nursing home locations and we already had them in the portal by the time the pandemic came along, added the pandemic COVID data and made the portal live, and we were good to go. So it was nice that we were pre-planning on that. And the concept of open data, by the way, is now very firmly gelled within the organization. People really, really now get why the pandemic data has to be open, it has to be self-serve, has to be consumed into these nice dashboards we just saw and all the other wonderful dashboards that are out there. It really has to be open. And again, that's a very new paradigm within our agency, and it's here to stay. So I'm happy about that. I'm not happy about the pandemic, but I'm happy about the opportunity to really have launched open data within the agency. Let's see here. It's also further exposed more need for collaboration and more data sharing within the state and within state government. Chris Diller from DMA, Coulter Sikora from Public Service Commission, Jim Giglorano, our Geographic Information Officer with DOA, and myself, and Scott Weber, pal, the GIS point person for Wisconsin Emergency Management. We met regularly, basically weekly, for a period of months and talked about data sharing and collaboration. And we basically had a support group, basically, for Andy to some degree, when I was looking at data that we were going to need, we were anticipating data needs, we were listening to the news. You know, Chris was going to the NISJIC meetings and hearing presentations from what other states were doing with pandemic response, and he was bringing that back to our group. I was hearing it, taking notes, and it really was a wonderful way for me to be supported and honestly more prepared when we came into a meeting and someone would say, well, you know, hey, can we do a map like that? And I could say, well, I hear Tennessee and New York and Oregon State are doing a map like that and are publishing those data. And by golly, yes, we can research that and we can do something like that too. And it was really nice to have that leg up. But we also talked about shortcomings, you know, what data sets aren't available. And I'm actually going to mention that in the next slide. Also, the pandemic is, you know, it's informing our infrastructure even further about just how robust it needs to be and what sort of redundancy and backups we really, really need if something really big happens like this. And so in budgeting and planning and forecasting with leadership, you know, at every opportunity, I think you all will as well, but I'm going to be there saying, you know, are we going to build it for today's known needs, or are we going to try to build this technology and this capacity for potential needs? In terms of staffing, again, it's really nice to have proven the concept of surge staffing. It's really nice to know that other agencies and other professionals will pitch in, and we can ramp up with staff, but we also have to make sure that our technology can scale. We can beg, borrow, or steal technology so that we can do it in terms of the data and the technology side of things as well. So almost done here. Appreciate your attention. Some positives. I wanted to have pandemic positives for the GIS enterprise. We really did expose the value of statewide data that we knew we needed. You know, we knew we needed statewide nursing home locations. We needed them authoritative. We needed them accurate. We needed to have them attributed with good information. Coulter can tell you a lot about access to broadband. You know, that's a data set that was important, and it had been, you know, published and it was in the works, but holy smokes, when you got how many gazillions of kids are having school at home, and some of them don't have broadband access, that's a huge educational equity issue, and literally just can you even do school? So it highlighted things like that. And then when we were earlier, like last spring, we were very, very concerned about food shortages, food security, Remember when the meatpacking plants were getting really hard hit by pandemic cases, they were being shut down, you know, shifts were being canceled, they weren't working as many shifts, et cetera. Throughput was affected by them spacing out workers more. We had some real food security concerns, and it was found out that we didn't really have a good food pantry locations spatial data set. And by the way, we still don't. It's something we're starting to work on, but we hope to have that someday. And we hope to have that and keep that at our fingertips so that if or when there's a local or regional or heaven forbid state or global crisis, that we have that data set to help with food security, to help the locals, to help the health departments, to help the counties know where they can do some planning for food security response or whatever it is they might need. The pandemic also exposed the need for statewide data that we never knew we needed. Animal carcass disposables, suitable areas. This is one that came up. We got, pardon the play on words, we caught wind of it. That the slaughterhouses were going to have no place to dispose the carcasses, or rather the farmers, if they didn't have meat processing plants to send their meat to, because the plants were either closed temporarily or they were shutting down their shifts and reducing their capacity by spacing out workers, that throughput was affected, right? Animals couldn't go to market, animals couldn't go to processors, and farmers were, you know, particularly in the big meat producing states, your Iowas, your Nebraskas, et cetera, they were hit really hard with having to actually euthanize animals, and it becomes a disposal problem, right? So we had to get into animal carcass disposable suitable areas mapping. Here's Jim G. Used to work in GIS at Iowa before he came over to Wisconsin. He's like, oh yeah, Iowa, they have they have a public-facing web map for animal carcass suitability areas, and he pops up the URL for us, and we're like, wow, you know. So we start working, you know, DATCAP, DNR, because it comes down to soil and groundwater table, depth to water, groundwater, and things like that. So it's like we're starting to think about where we're going to get into situations for disposing carcasses. And we never would have guessed we needed that data set, at least not on the DHS side. Mink farm locations. You might think, well, what about mink farm locations? What's that have to do? Well, this was a very, very recent one, just a couple of weeks ago. We're putting together planning for priorities for vaccination tiers. Well, right, you've heard in the news that the minks and the humans can pass COVID back and forth. So it's, where are the mink farms? Where are the mink farms in the state? And how are we going to distribute to them so that we can get the mink farm employees vaccinated as a higher tier of vaccinations? Never would have guessed that was going to be something we would have to have mapped. And as I talked about earlier with a wastewater sampling project, the sanitary sewer service areas. I didn't mention earlier in that slide that quite honestly, I contacted our friend and colleague, Larry Cutforth, the GIS coordinator at DNR, and I said, hey, Larry, we got this wastewater plant project brewing. Can you work with your wastewater folks and see if you can't pull together the wastewater treatment plant service areas data set for us so we can use that as for our dashboard? And Larry put us in touch with the right people, and they were like, yeah, we don't actually have those service areas mapped. And I was kind of like, oh, I made an assumption there. So again, as I explained to you in gory detail, we've been for literally months now, we've been working on pulling data in from the municipalities and the treatment plants themselves and getting them mapped. And we're still not done several months in. I think we started that in October. Also, another positive is we exposed the need for more interagency data sharing in state government. And how, the question comes up, how can we get more data sharing agreements and more knowledge of available data, more mechanisms for the technology side of sharing data? How can we get more of that stuff in place ahead of time so that when we work on an issue like this, that we're just more efficient and we have more, we can just save time. So that's that. Questions related to anything I talked about and anything else that you might want to know about regarding DHS data, GIS at DHS, pandemic response, or anything else that I can help you with. Thank you very much.
Okay, thank you. Thank you, Andy.
I do have a question. I'm not typing fast enough, so I figure I'll just yell it at you. Do you think after this year that the way individual health departments have very different perspectives, that there'll be more of the trying to get everyone on the same kind of page in the future? It's kind of a hard question, I know. We had very different perspective. We had 2 health departments in our county, so we have 2 distinct points of view.
Yeah, in some of the large meetings with the public health officers that I participated in talking about our plan or our proposal to publish data by school district boundary or data by ZICTA or data by minor civil division, we really did see, and I guess I would say what I really saw was I saw different perspectives and different opinions. I really felt that in every case, those perspectives and opinions were very well articulated, and they were based on actual local needs and had there was a reason why those professionals were articulating those disparate positions. And so honestly, it was fascinating. I'm giving you a bit of a non-answer, but I'm going to say that, from one part of the state or one region to another, I think we're going to expect differences in perspectives because of the regional differences and cultural differences and economic differences. To have 2 disparate opinions within one county, that's a little bit different. I do think that taking a very optimistic step, that, Kim, that by publishing statewide data, more statewide data where everybody's getting the same data feed, that at least it's not everybody working from their own homegrown or home, let's say, I don't mean this in a negative way, but their own self-derived, home-built data. I think having uniform, authoritative, universal statewide data sets is probably going to be maybe helpful because everybody's working off the same, they're dancing to the same music, so to speak.
I would say that your organization was a lifesaver for a lot of us because you had the information for us. It was, you're our favorite place to visit and to get information for sure.
Hear, hear. Let's give him a round of applause. Thank you so much.
Well, as I've said many times before, I enjoyed my job very much before the pandemic, and it certainly got harder during the pandemic, but it got, even more satisfying. And it allowed us to really continue to work with a purpose, and everybody wants to have a purpose. And I'm grateful to have had that purpose. And by all means, myself and my team, Ben, Joe, Julia, our surge support staff, Felipe, Kevin, and Michael, we were and continue to be honored to serve. It's an honor to serve. It's fascinating to hear the national news or to read, BBC and see our data in those, and it's fascinating to see it utilized by you all in local dashboards. And so we are grateful to the input we've received from many of you. We're grateful to the good questions that have come from all corners of the earth, and we feel like we have done our best under the circumstances, and we're just really glad to hear that the data were useful, and the maps and the applications we've been putting up have been of value to you as professionals, and of course, most importantly, to the citizens of the state of Wisconsin.
All right. Are there any other questions at all?
Oh, come on. Somebody's got to have some hard question.
Is there something that may have popped in the chat?
How much sleep have you gotten in the last year?
I'm a good sleeper. You got to take care of yourself. You got to eat well. You got to exercise, and you got to step away from it. So I play hard, and I play hard, and I rest well. So I've gotten a fair bit. So, but one of us is publishing the data still every day manually, 7 days a week. I'm glad we don't have any fewer than the 3.5 people we have on the 3.5 positions we have on the team.
I would just like to say thank you to Andy and to all of our county GIS people, Kim and Jennifer and all the ones from the earlier track. As a non-GIS person, we click on the website and there's all that information, and it's just really been eye-opening for me and probably others that have been listening, how dedicated you all are and how much time and energy and not sleepless nights, putting all that information together, creating maps, I don't even know what to call it, but just want to say thank you to all you guys out there. Came through and we needed you, and still do.
Yeah, we'll be at this for a while.
Okay.